This is a question that's important to me. I'm not serious very often, but this is something I'm very serious about because I spent my youth playing American football and used my head as a battering ram for 17 years. Okay. And then, and then, and then I went into mixed martial arts, into a combat sport where I never dodged a punch. I never met a punch I didn't want to eat. Okay. So I got hit in the head a lot. And
We can tell.
that's probably true.
I'm just kidding.
And look, CTE we have found is a very real thing. My brain is going to go to the Boston Brain Bank when I die. There's no test for it until you're dead, unfortunately, at this point. But brain health, maybe even CTE recovery, do stem cells, and I guess by extension peptides, have application in brain health? Ladies first.
So the answer is yes. But it is important to note that this field is still growing. We're still learning a lot, and that's a constant battle, right? We're still getting the evidence to support certain things, and those take years to develop. But we are seeing significant amount of exposure and growth in this field in terms of brain health. We have found that it's been very effective for patients with dementia, Parkinson's. Japan has actually utilized it as the first time treatment for this. And I don't know if you want to add to that, but there also, in terms of peptides, there are adjunct therapies, and there's certain peptides that work to decrease the inflammation around the nerve cell endings, which then help with the neural inflammation and whatnot that can be found in some of these chronic conditions.
It is the most exciting thing for me. It is so exciting. Because in neurological diseases, what you do, there's no getting better. It's just slowing down the regression. And why it's important to me, just like it's important to you, like this is too much sharing, but I had a brain hemorrhage when I was 21.
Whoa.
Half my face was paralyzed because of so much blood that was impinging on my facial nerve. I couldn't walk straight. There's a lot of things I had to tape my eyes shut because this whole part wasn't working. And you think about that, and you really get into neurological diseases because there's no reversal, really. What you can do is slow down the progression. Luckily, everything worked out. We're doing well. But what about those people with multiple sclerosis? What about those people with multiple sclerosis, demyelinating diseases? What about the people with Parkinson's? It's not getting better. You're just managing the symptoms. What stem cells have done, which is just miraculous, is the fact that it's actually helping with symptoms because it's decreasing the inflammation that's happening in the brain. With what Dr. Ajit Dhaliwal was saying, same thing, like decreasing inflammation and helping the nerve endings function more. Again, with this inflammation, like we talked about, chronic inflammation, it impinges on, sucks up all the energy that's supposed to be working. So you get rid of that and you decrease that inflammation, your nerves are going to be firing a little bit better.
So in the case of someone who wants to treat for Parkinson's, you said in Japan they've done it?
As in as a effective treatment that they've had. Because a lot of different countries are utilizing stem cells in a variety of conditions. Patients in heart failure, we saw.
We had a patient with autism. We had a patient with a demyelinating disease just recently. We had a patient with diabetic neuropathy. Couldn't feel his legs.
And that's just an IV general whole bloodstream thing, because obviously your brain is part of that circulation process, but you're not injecting stem cells into the brain stem or anything like that.
Because remember, it's a central problem.
So there's hope for me yet.
I don't know. I don't
think it fixes. It doesn't fix stupidity.
No.
In your professional medical opinion, there's no hope for me. All hope is lost.
No, but to be honest with you, this is the most exciting part of stem cells. Like, to actually, like, have you ever, like, I don't want anyone to see this, but people with like MS, when they're walking and they can't walk and they need crutches, but like, I had a patient, and you guys should look at our Google reviews. This guy had a spinal cord injury. With just one IV infusion, he started getting his functioning back. Like, that is amazing. Before things that we thought could not be reversed are being reversed.
Okay. This will be my last question, I promise.
No, it's not.
Well, for now, I've been a teetotaler my whole life. I don't put things in my body, all right? I don't do recreational drugs. I don't drink alcohol. And even when it comes to medical treatments, I have a skepticism about whether like I want to be putting things in my body that don't already belong there, right? Especially while a fertility window is open. I'm married, we have young children, maybe one more, and that has been my reluctance with peptides to this point in my life. I don't know if they're going to affect fertility. I don't know if they're going to cause a deformation. I don't know if there's going to be a birth defect because of this, because there's not enough research, right?
Yeah.
Stem cells, same thing. For someone who's in that place in their life where maybe they're holding off on this thing because of a fertility question or something like that, are there studies to look into? Is there application in those areas? Again, ladies first.
So a few things. One, yes, right. There's still emerging evidence, so it's going to take time to see those changes. Also, when we're looking at studies, a lot of times if you look at random controlled trials, they're not testing pregnant women. If you look at OB-GYN as general field, we don't have too much data because you're not going to use a pregnant person
Right.
for a study. Oftentimes we don't, right? But in terms of stem cells, very low risk, and I'll let him dive into that a little bit more. And in terms of peptides, there's actually an FDA-approved peptide that is helpful for sexual dysfunction, and there has been some question about whether it can be helpful in fertility or not, but not necessarily harmful. And so it is interesting because that one is specifically FDA approved, and I think it's important to know that some peptides are FDA approved, whereas a lot are not. And again, the evidence is still coming out. Even though it's exciting exciting studies that are coming out, we still don't know the long-term effects of many of these things. But overall, stem cells have a very low risk. I've gotten stem cells for aesthetics, and I've done IV exosome, and I would never promote something that I wouldn't do myself. One, I'm also like that. I don't do fillers. I don't do any of those things. And so I don't take medications, ironically, right?
As a doctor, prescribe them, but don't take them.
Because
Trust that.
fortunately, I'm healthy for now. So I don't have the experience of all these musculoskeletal injuries that he has. I guess I wasn't as athletic as him.
Or maybe more so. You could participate in sports without getting hurt.
I just play the sport.
It's hockey, man. It's always hockey.
It was just a bad driving thing myself.
The hockey injury.
Tripping about.
The hockey injury was actually tying the skates.
From a men's health perspective, let me break down the physiology. You have latex cells which release testosterone. I've had patients that come in with low testosterone that have to be on TRT. We've actually gotten them successfully off TRT because
With stem cells?
yeah.
Wow.
All we needed to do, so you have latex cells, right? They release the testosterone. But guess what happens? The receptors, the messengers to the receptors to release more testosterone, they're clogged up by what? That chronic inflammation, those dead cells, those zombie cells. And those zombie cells accumulate as you age, right? Now you come in, you clean that up, and guess what? Now you start releasing testosterone again. And we've had numerous patients where because TRT, once they're on TRT,
You have to stay on TRT.
yeah, you're going to increase. Or let's go to the root problem. Before we start putting Band-Aids on issues, let's go to the root problem. Let's see what's actually happening. And the great thing about exosomes, the way we do at Regen Health Physicians, exosomes are differentiated. You can get differentiated exosomes. Messenger cells that are just for the testes or just for the ovaries. The stem cells will go. The messenger said, hey, let's go work on the latex cells. And that's what we have done at Regen Health Physicians with IV therapy. IV stem cell therapy successfully got people off of TRT.
Wow. Okay, now we're going to go to the novice part of the podcast where the person who's bad at questions is going to take this chair and just bore all of you. David?
Well, speaking of that, like on the same, I'd love it if I could get my hairline back. I'd love it if I could be doing some of these things, not just from a functional standpoint, but from an aesthetic standpoint. What of that can be treated with stem cells and peptides?
Of course. So what's really interesting is your skin is your biggest organ. And it's the same analogy. You have these zombie cells. As you get older, you get this chronic inflammation from these zombie cells. What stem cells do, in this case, the consortium workers, they decrease that message of inflammation that these zombie cells exhibit. But the thing is, you can't make new skin because your receptors aren't working because of this chronic inflammation. So now I'm injecting stem cells in your skin, your biggest organ. So think about this. They're making new skin. We're not anti-aging with Botox. We're reverse aging because we're making new skin, new collagen, right? And the wrinkles come from, why wrinkles happen? Because they can't make the new collagen. So your skin slowly becomes dormant and can't produce the new skin cells. And that's why you get wrinkles.
Okay. Well, same question though for the hair.
Fair? Okay, cool. So what?
I'm not saying I have a problem. I'm just saying there's some people on this podcast that might be interested.
So hair restoration is the coolest thing, because here's the thing, right? When you get a hair transplant, it's basically like putting turf on top of your head. You're still having you're relocating your hair. What we're doing is regenerating your hair. Hair restoration is from a regenerative standpoint. We're going to the root problem, and that figuratively and literally, because what you're doing.
So proud of that. Did you see this?
I did. You can tell he's like, ooh, I've got a little gem here.
I truly can't stress this more, but that's what happens in what it affects your hair follicles. What happens to your root is that it becomes dormant. It's not dead yet, it's dormant. We go in there with stem cells into your scalp, put in live stem cells to start not only building up the roots, but waking those dormant cells up. And as they grow, the hair is stronger, thicker, just like it was when you were younger, not thinning out because of chronic inflammation. Hair, and this, now, if you want to talk about peptides, GHKQ, and there's another one, right, that's coming out. These help. They're all help. They are part of this protocol because they also enhance the growth. We can do it from a surface level, and we do it from a root level.
But as does PRP and exosomes, right? So exosomes are the most effective with the stem cells in terms of hair restoration, and as well as just skin aesthetics. So for, again, the female population, or even men, right, you want to look younger.
Now, this is actually what I wanted to ask you. Is so, what's the percentage of men to women that are getting treatment from you for an aesthetic standpoint?
Definitely more women. I think men, there's more men for sexual health than anything else, and hair restoration.
Wait, so you're saying you're getting more men coming to you for sexual things than even regenerative or?
So I would say for men, it's joint, then it'd be follicular and the hair restoration, as well as men's health. And then aesthetics is on the bottom in terms of how your face looks and other things like that. Whereas women, it's mostly aesthetics.
And going to men, the reason why it goes joints, hair follicles, and then sexual, we're scared to talk about it.
Exactly. There's a big stigma for men to go get help of any kind, especially medically.
There's stem cells, and of course they want to look younger.
And joints, you want to get function back. Hair, guys, that's our weakness, right? For women, it could be aesthetics or other things, right? But sexual health, we're so scared to talk about. And that's why it's lower on the list. Really, if you look at what is your biggest pain point, it's definitely going to be sexual. If your sexual health is down, that's associated with depression, that's associated with low energy levels, that's associated with a lot of bad things, just with sexual health. And because we're so scared about it, because we want to be the man, we want to be tough.
Interestingly enough, I think by the age of 50, more than 50% of men have some experience with erectile dysfunction. By that age already, more than 50%.
Wow.
And I think it's probably more people just don't talk about it.
So,
right? These are the studies that they've collected, is that more than 50% of men are struggling with erectile dysfunction and sexual health by the age of 50.
And with one IV infusion, if you could change the trajectory of that with one IV infusion and one P shot, you could change everything. Your energy levels are up. You're more confident. Confidence is the biggest thing with men, right?
Well, I agree. And that's why I'm hoping that people listen to this and they realize, hey, you're not the only one. A lot of people have these questions. I have these questions. Sean has these type of questions. There aren't many people I know that are tougher than Sean. It's okay to have these questions and concerns and want to get help and get treated. It's not a bad thing to try and improve yourself physically, emotionally, mentally, functionally. How do they do this without all of a sudden they're like, oh, he's going and getting treated and the stigma that goes with?
So I guess my question for you to answer that question is, do men feel, when it comes to sexual health, do they feel more comfortable with a male provider versus a female? If you were going to go in and say get a P shot, would you want it to be a male that's giving you the injection, or would you want a female? When we're talking about people being more open about this, is starting to have those conversations at the gym, in your circle of friends, and basically normalizing it, right? We give it power because we don't talk about it.
I agree, and I think one of the things we're not talking about is like the question that always comes up is like, well, is this something now that I have to do forever, or like if I went, let's say if I'm a guy who has erectile dysfunction, or if I have a receding hairline, or if I have something, how long am I going to have to do this? How often am I going to have to revisit this? What's the treatment plan for something like this?
So I feel like I can't fully answer that question because I don't know if I know the answer for how frequently you need to get these injections. They do last quite a bit of time, right? Because the whole idea is that you're increasing your growth factors to that area and improving your blood supply, which is the underlying issue for most conditions. I wouldn't know because I don't have that time yet. In like we're still learning.
And it's also dependent on the person. Like, for example, for us, majority of for erectile dysfunction, one and done. And the longest follow-up of that is for 3.5 years. So for 3.5 years, one injection. The whole point of the stem cells and the exosomes are to make your own body repair, your own body to rebuild, your own body to regenerate. Because guess what? We put in stem cells, we're putting in new mitochondria, we're helping you work. But the exosomes are telling you're already the stem cells in your body to come help fix this problem.
And I want to make sure like nobody on the podcast is getting confused. So again, we're talking about a variety of treatment options, right? We have the stem cells and exosomes, which are usually given together, especially in the protocols. But then when we're talking about PRP, that's the P shot. So I think everything works. They work in different mechanisms, but effective in terms of how long stem cells. I think you can go much longer without having to get a booster or whatever it may be. PRP, I don't have for the P shot. I don't have that information to know what is the other one.
It's been studied longer, and it's more. The studies are more available.
But I hear with the peptides, that's a constant thing. You're having to renew over time, do multiple things. And is that something that has to be done in clinic? Is that something you can do at home?
So again, we were talking about that at least one peptide that is FDA approved. But it is a continuous, that specific peptide. It is PT141. You shouldn't do more than one dose in a 24-hour period, and you shouldn't do more than 8 doses in a month. And so there are specific safety rules you got to follow when you're doing some of these peptides. And I think some of it might be more of a long-term, and these are injections that you can do at home.
But the most important part about peptides, regardless of their indication, and we stress this a lot, is clinician oversight. The dosing, the cycling, the side effects, the interactions, the sourcing,
And contraindications.
Contraindications,
Recognize that they're not.
People go crazy. It's like, oh, I bought it from China. That's great. Oh, I bought it from this one lab. I bought it online. Guys, it's still something going in your body. I know it's natural because it's working on certain receptors for your body to release the growth hormone or increasing fat metabolism. I get that part. But what if you do it too much? And a lot of these, you don't even know the dosage. It needs to come from compounded pharmacy. It needs to be third-party tested. All this stuff is extremely important because, again, it's going in your body.
And some of these peptides require monitoring and labs during your treatment. A lot of them are pretty safe, so you have like baseline labs and you do post-treatment labs. To say, example, inflammatory markers, you want to see the change in it in your, say, 3-month course that you do. But there's other peptides that require checking your kidney or liver function during their treatment because, again, there are side effects that people aren't aware of, and they get excited about the benefit of this and this and this, but then we're using it recklessly.
And speaking of being reckless, I apologize for pulling you in here when you wanted to be on camera. I will let you, but thank you so much. You were just talking about saying, hey, it's important to differentiate the application of the stem cells and whether it's done through IV or if it's dangerous to do it this way. Can you talk about that?
Yeah, for sure. So again, if it's an acute injury or specific injury or like post-op recovery, then it's the most effective to do focused or localized injection, right? So say you had a meniscal tear, getting an injection into your knee is going to be the most effective, right? But there's also things like IV stem cells for longevity purposes. It's important to note that with IV stem cells, they can be quite large in size where it can get trapped in the lungs. And I think that's why it's important to make sure you have exosomes in your treatment as well because they're much smaller and they can cross the blood-brain barrier and again help redirect the stem cells to where they need to be.
That's the messenger one who tells it where to go.
Exactly. But the stem cells itself are quite large and get trapped in the lungs.
As this is an emerging field, right, with stem cells, with peptides, and all of this, if we had been doing this podcast 2 years ago, how different was the information then, and different will it be in 2 years?
I think
The future for me.
I think
That's a great question.
I think the answer is just education and continue to do these, to get our studies, do case reports so that other physicians can help their community to get better, regenerate, do the things that they need to do to help live a full life. 2 years ago, again, the answer is we didn't have as much information. And 2 years from now, we're gonna have more information. I also wanna mention that like in the States, we are behind, right? There's Sweden, Germany, India, Japan, all these countries have been practicing or incorporating stem cell or regenerative health into their treatments for many years. And so a lot of the studies that we do have now are based out on these countries. And again, we're still not there, right? Here in America, people, again, there's a lot of skepticism around stem cell therapy, and there's always going to be in something that we're not sure of. There's a lot of fear in the unknown.
Is this still considered fringe medicine? Is it like controversial when you're a physician? When Dr. Ajit had,
Yeah, we're accepted.
I think 2 years ago, probably for sure.
so if you told your colleagues, right, from med school or wherever else, like I'm going to go into stem cells and regenerative medicine with stem cells and peptides, and your roommate from med school is a heart surgeon, are they rolling their eyes and looking at you like might as well be a chiropractor?
No one said that to me.
By the way, chiropractic, you've changed my life. Just blue.
I got just blue. Don't punch me in the face for that. That's pseudoscience, though.
I work primarily as a hospital medicine doctor. And so when I was talking to my colleagues, again, there's a lot of excitement regarding this more than skepticism, because I think we've gotten that far. If we're comparing to 2 years ago, absolutely. Right? It's like it was thought to be illegal. It was thought to be this and that. And of course, people should ask questions. And I think people also need to acknowledge that, again, evidence is emerging. We're learning. We're all still learning, but we have enough to support what we're doing at this point because we've seen it work in so many other countries.
I'm asking an unfair question. If you want to cut it out, just tell me.
I think I already
It costs.
Exactly.
feel like he should be answering this because he's like the one that's
Business guy.
Okay, we'll give you your chance to escape again.
I know, it's like, right? You see that slide out? It depends on what treatment, though. So if we're talking about, so again, the four main treatments that we offer in the clinic are stem cells, exosomes, PRP, and peptides. They're obviously cheaper, right? Because we're doing the oversight, and it doesn't require that much physician attention, right? We figure out what protocol, what peptides work for you, depending on what your goal is, and then just checking in, getting labs that needed or required, depending on what you're getting. And then PRP, I'm not sure if you guys know much about PRP.
I've known about PRP vaguely for many years because, again, working in sports, Peyton Manning, famous quarterback, Peyton Manning went and was one of the first guys publicly that's like, I got this platelet-rich plasma injection, and it's changing my life. So,
Because this idea is you're getting your own blood drawn, you're putting in a centrifuge, you're spinning it to separate the plasma, and then you're injecting it where it needs to be. So the chance of rejection is 0%. It's your own blood. Okay. And so I think that's what makes it more appealing. And again, it's used more as an adjunct therapy to the stem cells and exosomes. And the issue is the stem cells and exosomes are the pricey part of the protocols. And now I'm going to step out because I was already supposed to get out.
Hey, great job.
thank you, doctors. I don't know how much of this your health insurance even covers. It doesn't. It's a different podcast, by the way. Health insurance in the United States, what a racket. But how much does this stuff cost?
So it's definitely not covered by insurance, and it is costly. It also costs us money to get the stem cells. Again, they're donated, they're in the lab, a lot of testing is done. For us, one injection, so we start off with a IV, intro IV. That's just, again, the primary system. That's at $39.99. That's with exosomes.
So that's $4,000. Okay.
And then let's say a joint starts at $39.99, which is $5,000. Okay, I know it sounds like a lot, but what if I told you especially with us, we've had over 90% success rate in that. That's pretty good. That means like actually returning to your activities. So this means And a lot of them they either have to do surgery, which is like the repair by removal, or you do repair by regenerate.
Go along the same thing. Let's say it's not knees, it's your back and your spine. Asking as an interested party, let's say somebody has herniated discs, or what's that treatment plan?
So it depends. It depends on the person. Depends on how damaged it is. Depends on comorbidities. Depends on a lot of stuff. Do you need the IV before so we can get the stem cells and exosomes in there, and then we do the injections? That's a different thing. Now here's what people don't realize, right? When you have a lower back problem, I had a lower back problem. I had to get back surgery again, just from tying up my shoelaces. I had to get some of my spine shaved off because I had sciatica, right? But even after I got surgery, still had sciatica. Now, have you ever realized why in sciatica you can do certain exercises to get rid of your sciatica?
No.
Because it's not a spinal issue. It's from the spine, but it's the muscles and tendons that are attached to the spine that every time your nerve comes out of it, impinges on it because it's injured.
It's inflamed.
So it's inflamed, so it compresses this, and you get that shooting. So it's not, you do have the disc herniation, but the thing is, what's injured is what's tethered to the spine. The ligaments, the tendons, the muscle. That's what's injured. And then when you have a herniated disc, it moves like this, right? So guess what gets pulled? Your tendons, ligaments, that's what gets torn. Now, if you start repairing this, there has been studies where it actually shows that the herniated disc moves a little bit. I'm not saying it completely fixes it, but it adjusts it because you strengthen what's holding it in. And then with that, guess what? The inflammation that's impinging on your nerve no longer is impinging on your nerve. And now you don't have sciatica.
Yeah. Well, on that note, it's funny because it's actually a chiropractor, which I do approve of if you get a good one. For the record, Sean O'Connell, Jess Blue, Dr. Clark, you guys have helped me enormously. But it was actually one of them who recommended saying, yeah, doing decompression, like true decompression with stem cells and peptides, it can actually help. And so what are your thoughts there?
No, and I totally agree. We're actually, Dr. Ravni and I are actually working with a chiropractor out of New Zealand who travels the world because he's that good. And we figured out that we can work collaboratively to actually do this. And just like that, you do decompression, take out some of that pressure, but also repair and regenerate at the same time. You're taking away that pressure because you keeping that pressure and it not being, it's being adjusted and things like that, it's causing that inflammation. We need to loosen it up a little bit so we can do that, the cleaning that the construction workers do and repairing. So it works synergistically.
All right, I'm going to ask the pea shot, how much does that cost?
So it depends on,
Is it depending on how big? Because it's going to be cheap for you. It's going to be so cheap.
the entry point is $5,000.
Okay.
But
Now, I'm asking that like point
For a
blank
friend.
because asking for a friend. No, but
no, peer review is like cheaper, it's 35. But here's the thing, this is throughout, right? Like, say your face, it's not going to be one, just 5,000. Like, we need to know how much we're going to use. How much do we need to work on?
Of course.
If you have significant, let's say you have significant cardiovascular disease. Say that you have high cholesterol. Say that you have chronic venous disease. We have to work a lot down there because we have to open up the veins. We have to open up the highway, right? We have to open it up so the blood flow can go there because everyone knows that it's a blood flow problem.
Sure.
So if you have plaque buildup, if all these issues, we need IV stem cells to really go and prime up the system, and then you can do targeted therapy.
by the way, that is one thing that I think most men would be like, I'll pay any price to restore sexual health.
That's important all the way around.
It is. Exactly. Testosterone improvements.
I didn't mean it that way. That's going to get cut.